To show how to don and doff cervical collars, we will show both typical supine method and the log roll method for dressing changes. After positioning the patient flat in bed, consider the patient's anatomy if needing a pillow or not. Typically is easiest and recommended to do without a pillow, but extreme kyphotic patients may need this. Second person is behind the bed, using both their hands to stabilize the patient's neck, oriented around their ears. In order to don the collar, first you're going to look for the markings to orient the front and the back and the top from the bottom. Then you'll begin to slide that behind the patient's neck, right where it should be placed, keeping their hair outside of the brace. Once that's in the correct place, orient your front piece, place that underneath their chin. It should be snug and placed inside of the outside pieces. From there, then you can take your Velcro and fasten securely. You want this to be very snug. You do not want any gapping or spacing around the chin. For the log roll method, if this will be used when needing to change their dressings. So first you will want to place that chin piece to stabilize the patient's chin and keep their head in neutral, while your second staff member is again still behind and stabilizing their neck. Then you will roll the patient. Place your back piece, making sure that the hair is tucked away. There you'll have access to your dressing changes if needed. Place your back piece, orienting correctly based off the markings on the collar. Once that back piece is placed, then you roll the patient back onto their back and fasten your Velcro straps. Again, there should be no gaping or extreme space around the bottom of their chin. This will show the markings that we're looking for when we're orienting the brace correctly. You have front and back. Your front piece will have that hole there open above where their throat would be. This is showing the fit that we're looking for, so it is very snug against the patient. There is no room for the patient to move their chin up, down, or sideways.